Hi, my name is Dr. Judith, and I'm a child and adolescent psychiatry fellow at the NYU Child Study Center. Thank you for joining us for our Grand Round series where we get to talk with experts in the field of child and adolescent psychiatry. Today we have Dr. Mary McKay with us, and she's the director of the NYU McSilver Institute for Poverty Policy and Research. Thank you for joining us today.
Thank you. It's my pleasure.
So, in your talk, It Takes a Village, you talked about the importance of bringing together all of these different groups, researchers, policymakers, parents, teachers, and clinicians, so that they can provide better care for children. Tell us more about that.
Well, I think that if I can back up for just a minute and just talk about what we have known for decades, which is that there is still a very big gap between what children need in terms of mental health care and what they actually receive from the systems that we've set up to help them. And so our research really tries to figure out ways to close that gap. We have just excellent children's mental health treatment researchers, children's mental health services scientists that have really tried to close that gap with, producing new knowledge, producing new evidence-based treatments. But what we've seen in real-world clinic settings is the knowledge doesn't translate into the systems that we've set up. And so our work is really trying to bring together consumers, providers, organizational leaders, funders, and policymakers to figure out how we can really translate in a more efficient and fuller way what we know into what we do.
So it sounds like there are these evidence-based and treatments that are proven to be effective, and then there are other treatments. But the treatments that are proven to be effective aren't utilized.
Well, I think that's the gap that we're talking about. So I think that there are a small and growing, I hope, number of sites that can implement evidence-based practices. But have we done what we needed to do as translational scientists to figure out how those treatments are easy for providers to use who are very busy, how those treatments are appropriate for children that have more than one issue at the time, how those treatments are really explained to families in a way that they're understandable and potentially align with what families are hoping to get out of this experience. I think there's a translational piece of research that we really have missed, and that's really what our group is trying to do, is fill in that gap.
Wow, that sounds really hopeful. I know that all families can benefit from something that you call the 4 R's and the 2 S's.
So what are those 4 words that begin with R's? Those are our code words for what the evidence base suggests you as your family can do to help your child. So one of the conceptual categories is rules. The organizational structure of your family really matters. The rules, the consequences, the rewards, kind of the working set of guidelines that kids operate within and sometimes outside of within a family. Relationships are the glue that holds kids and their parents together. If you have a child who's struggling behaviorally, those relationships can really tatter. They can be in tatters. They can be really stressed. And so we try to remind kids and their parents that the relationship is really the foundation for living together into it. And we try to create a very hopeful, fun way to build those relationships. Roles and responsibilities, important for parents to be in charge and have leadership roles, but kids also to contribute. And so the family becomes a positive place where you live out your roles and responsibilities. Finally, respectful communication, talking and listening to each other, not yelling, but true talking and listening, communication, incredibly important. What's also really important is to understand what are the factors that really build families up and what are the factors that tear families down. So that's where the 2 S's come in. There's stress. Stress is a huge impediment to moving forward as a family, and many families are facing inordinate stressors. And so we do a lot to really help families to identify what are those key sources of stress and how to lower the temperature. Also, social support. It is an incredibly big job to raise a child, and that the notion that we can do that by ourselves actually is fraught with all kinds of real problems. And so where you as a family get sources of concrete support, emotional support, inspiration, incredibly important to do a very hard job.
Well, we learned so much today. Thank you so much for joining us.
Thank you so much.